My pleasure and privilege to introduce the next category for awards, the Community Investment Award with a specific focus on HIV/AIDS, TB and malaria. We have some very exciting and impressive companies here that you will learn about that have done tremendous good work on the ground really to save more lives. We have two companies that will be commented this morning, and then we have a winner. I will start with the first company, which is being commented then in this category, and that's the Hippo Valley Estate. The Hippo Valley Estate company is an agriculture company working and located in Zimbabwe. They have been achieving tremendous and impressive results in terms of engaging the community and the workers, of course, in their companies to reduce the prevalence of HIV/AIDS. They have seen a drop in terms of HIV/AIDS prevalence amongst the workers coming down from almost 40% to a little bit more than 10%. They have achieved almost 100% coverage then on reaching HIV/AIDS positive pregnant women. This has been good, of course, for the people that have benefited, but also have been hugely effective and useful for this company. Unfortunately, they can't be with us here today, but I would just like us to give them an applaud, and they will receive their certificate at a later stage. The next company is a company that is coming from a country that I said I've been working in, and that is close to my heart, that is in Zambia. Mopani Copper Mines. This is in the Copper Belt province in Zambia. This is also a program that has been working both in the workplaces, targeting, ensuring people are testing, but also providing treatment, care, but also mobilizing the communities and reaching out beyond the actual employees. Impressive results here as well. They have got the mother-to-child transmission down from 34% to 2%. Quite impressive, contributing now to basically that we should ensure that we get the maternal mortality and the mother-to-child transmission down to basically to zero. They have achieved a lot also then in terms of community engagement here. I'm very happy here to have Ron Ocello from the company to receive the certificate and the recognition of the Global Business Council HELP for your excellent work. And then it's my great pleasure and privilege then to present the winner. The winner is a company that is well known to you, mainly possibly for its work at the global level and as one of the major players in the pharmaceutical field. But what they are being now awarded for here is community work, engaging with the communities in terms of health-seeking behaviors, making sure that people are aware about what they can do in order to prevent, in this case, malaria. Reaching out to communities, ensuring that they are not just accessing bed nets, but also de facto using bed nets. Also very impressive results in terms of actually showing that access to malaria treatment is increasing, people are seeking behaviors, people are able to know when they need to seek behavior and when there are symptoms of malaria. Thousands of bed nets has been distributed. This is a community-based program in Ghana. That has been supported then by the winner, who is GlaxoSmithKlein, and I would like to welcome Andrew Wright, who is the representative of the HDA.
The African Malaria Partnership is a program where we are training community health workers in malaria.
I work with FHI in partnership with GSK to bring a change to the place that I am coming from.
This is a school where the children do the teaching. At the Fight Against Malaria Club, children are teaching their younger pupils about malaria prevention and treatment. Through preventive methods like mosquito nets and treatments and better education, we can help to diminish the worst of this disease. This is the Mothers Against Malaria Club that gets together once a week to allow mums to hear more about malaria prevention and treatment, but more importantly, they learn the tools to provide healthy malaria behaviour. We're educating communities, and this process is now set so that when the conversation has shifted from malaria to other health issues, children will become used to learning from older children and mums learning from other mums, and this is the best part of the African Malaria Partnership.
Well, thank you very much for this award. We heard in the session that almost 7 million children die needlessly each year from preventable causes, and 700,000 of those die from malaria, almost all of whom are children under the age of 5 living in Africa. And community programs such as this is one way that a GSK can make a difference. But we could also use the power of our business. And you heard from Bill earlier on about the vaccines business. We've been working with partners now for 30 years to develop a malaria vaccine, which is almost at the end of its clinical trials and should be available at the end of those trials in 2 years' time. And that will add to the armory that the world has to tackle the terrible mortality due to malaria. And last week we announced a new partnership with Save the Children, with a completely different type of way of a company working with a charity. Not only are we going to give them some money, we'll give them about $25 million over the next 5 years, but we want to engage our power of our R&D organization to develop pediatric medicines for children where there are gaps today. We want to work with Save the Children to extend vaccine coverage in the poorest countries. And we want to engage the power of our consumer business to develop nutritional products. And we want to turn on the 100,000 staff we have to raise funds, to volunteer, and to give of their own money, which we will match as a company to the work of Save the Children. So we believe that we as a pharmaceutical company have a great role to play in tackling developing world global health issues. And it's very nice once in a while to have one of our programs recognized. So thank you for this award.